Hello everyone, my name is Yasaman Safarpur and I'm a PGY2 at UCR Internal Medicine. Today I will be presenting a case of subacute thyroiditis associated with COVID-19 infection. So as we know, subacute thyroiditis is a self-limited disease that can be of a viral or post-viral origin. It usually presents as neck pain, general symptoms, and thyroid dysfunction. Many viruses have been identified as the cause, such as Coxsackie virus and adenoviruses, but here we describe a case of COVID-19 related subacute thyroiditis. So we had a 31-year-old female with history of subacute thyroiditis with complete resolution in 2015 who presented to the primary care physician in April 2020 complaining of severe hair loss. 3 weeks prior to presentation, she had experienced GI symptoms, diarrhea, and abdominal cramps, as well as upper respiratory symptoms, including sore throat, cough, and notalgia, leading to a nasopharyngeal swab test for SARS-CoV-2, which turned out to be positive. Her symptoms were mild and mostly improving, except for the notalgia that continued and was followed by a diffuse neck pain, and then hair loss. Both the notalgia and neck pain were worse on the left side. When she presented to the primary care physician, her physical examination was significant for a slightly enlarged and tender thyroid gland. The initial workup showed an elevated TSH of 6.5 that was previously normal. Other lab tests, including anti-TPO antibody and TSI, were within the normal range. Given her history of subacute thyroiditis and new onset of similar symptoms, she was followed up during a course of 5 weeks until complete resolution of her symptoms. On week 5 after presentation, she had a thyroid ultrasound and repeat thyroid function tests, both of which were completely normal. So in our case, the chronological association of patient's notalgia and thyroid pain with the discovery of the patient's SARS-CoV-2 infection suggested that acute inflammation within the gland and thyroiditis may have been caused by the infection. And even though thyroid dysfunction in subacute thyroiditis usually follows a three-phasic course of thyrotoxicosis, hypothyroidism, and then euthyroidism, in our case, we presume that the thyrotoxicosis phase was transient and therefore not detected during the initial workup. Since the beginning of the pandemic caused by the novel coronavirus in March 2020, there has been growing evidence of thyroid involvement associated with COVID-19. And to our knowledge, there has been only a few cases of subacute thyroiditis reported. Data from the initial SARS-CoV outbreak in 2002, however, had previously shown that thyroid tissues obtained from patients who died from SARS were significantly affected by the disease with extensive injury to the follicular and parafollicular cells, but the virus itself was not detected in these tissues at that time. So this is suggesting that coronavirus may cause thyroid inflammation or an immune-mediated response with inflammatory changes within the thyroid gland. However, whether these findings apply to SARS-CoV-2 is not clear at this time, and we need more studies to clarify the pathogenesis of thyroid involvement in this group of patients. At this time, we need to pay attention to thyroid dysfunction, including subacute thyroiditis in suspected or confirmed cases of COVID-19. Thank you for listening. Bye.